Community Plan by Austin B. Smith. Introduction. My community project was in partnership with the YMCA as well as other community organizations and people. The goal of my project was to engage with leaders of the community, residents, and health organizations to promote increased participation in health resources available and to receive feedback from the community on what barriers or factors they perceive that they may be preventing them from achieving the healthiest lifestyle they could. Definition of community. The community of North Royalton is a suburb of Cleveland, Ohio, and is in Cuyahoga County. According to Census.gov, North Royalton has a population of 30,239 people, with a median household income of $69,236. Of this population, some interesting facts include that North Royalton is home to 1,474 veterans of the military, 92.2% of the population is white, 25.6% of residents are under 18 years old, and only 7% of the population doesn't have health insurance. Windshield survey. One of the first steps in the community nursing project was to physically go out in the community and observe and document what I saw in the community. My windshield survey took me a few hours since the community is semi-rural and everything is not centrally located. I started with an in-depth survey of the community to determine a baseline of what the community was comprised of, what resources I could find, the general nature of the community, and to see things I could not find in publications. In the book, Intro to Community-Based Nursing, author Roberta Hunt states, "For nurses to be able to knowledgeably plan services for a community, it is essential to know a specific community, identify health-related resources that may be helpful to members, and learn about gaps in services. A windshield survey is conducted from a car and provides a visual overview of a community, conditions and trends in the community that could affect the health of the population are noted. This data provides background and context for working in the community or for conducting a community assessment." Community assessment data generation. The hospital system Metro Health did a community assessment on Cuyahoga County, in which North Royalton is located, and determined the most prevalent diseases in the community. The leading causes of death are listed in the chart below for Cuyahoga County, Ohio. Heart disease, 193.9, cancer, 179, chronic lower respiratory disease, 36.8, accidents, 41, stroke, 34.8, Alzheimer's, 18.9, and diabetes, 22.1. These numbers reflect death per 100,000 population. The community of North Royalton is serviced primarily by University Hospital's Parma Medical Center. According to the organization's website, Parma Medical Center is a 332-bed full-service hospital that employs 2,000 Northeast Ohio residents, including more than 500 physicians trained in more than 30 specialties. This includes experts in emergency medicine, heart and vascular, cancer, bariatric surgery, pain management, and rehabilitation. UH Parma Medical Center has also received national recognition for our orthopedics program and cardiovascular outcomes. My main partnership was with the local YMCA director. This partnership allowed me to utilize resources that were previously unavailable to me. The director's role in my community project served as the main contact and resource for the project of increasing awareness and participation in local available health resources. The YMCA is the largest community health resource in North Royalton and has something for every age that can help achieve a more active and healthier lifestyle. The North Royalton YMCA serves 8 cities that surround the area. The facility has over 16,000 members, served more than 855 kids in the summer youth sports activities, and taught 1,371 swim lessons in the community. Community health diagnosis. My community health diagnosis was risk of community knowledge deficit of health and recreational resources among the residents of North Royalton, Ohio, related to the lack of advertisement, community engagement, and visibility. My short-term and long-term goals for the community health project. The short-term goal for this project was for more people in the community to recognize and utilize available community resources. The long-term goal for my community would be to improve community engagement and to add resources that address different populations in the community. Community health plan. The objectives of my community nursing project were developed at the beginning of the term, and some were revised throughout the process. The main objective of my community project was to work with members of the community to increase knowledge and participation in local health resources that promote a healthier and more active lifestyle. Another objective I had was to gain feedback from members of the community on their current lifestyle and what they use to maintain healthy activities through the winter months. Another important objective I had was to determine the available resources and to expand my knowledge of the resources so that I could share the information with the community. The objectives of my project were important to me and outcomes would benefit the residents of my community. By participating and utilizing the resources in the community, the population of North Royalton could decrease health issues, get in better shape, and develop a stronger sense of community by engaging with other members in the community. When asked in a survey, community awareness of the North Royalton YMCA, 64% of people said yes, that they knew that it existed, and 36% said no. When asked what they do for winter exercises, 8 people said group exercises, 4 said no exercise, 2 said basketball, 11 said run or walk indoors, 3 said swim, and 5 said lift weights. Community health plan continued. I created a survey and received feedback from 33 residents in North Royalton to help me better meet the needs of the community through my project. The charts are the results from the survey. When asked what factors that have prevented people from joining the YMCA, 6 said cost, 11 said time, 5 travel, 4 work, 5 family, and 2 for school. When asked that after learning about the YMCA indoor facilities, how likely are you to join, 9% said not very likely, 9% said not likely, 40% said neutral, 33% said likely, and 9% said very likely. When asked if they had an interest in living a healthier lifestyle, 91% of people said yes, 9% said no. Asked what resources or equipment they would like to see in North Royalton, 5 said a weight management course, 6 said a community pool, 4 said an indoor gym, 4 said weightlifting, 9 said group exercises, and 5 said youth activities. When asked what areas that participants would like to improve the most, 15 said their diet, 14 said exercise, and 4 said pain management. Proposed interventions. One of the interventions that I implemented in my community nursing project was conducting a survey of North Royalton residents that assessed their knowledge of the resources available at the YMCA. The survey also asked other questions about what activities they'd like to do in the winter to remain active, their likelihood of utilizing resources, and more. I implemented this intervention at different times and in different settings to have a more comprehensive survey pool that better reflected the community as a whole. I also developed an analysis of the data collected to share with my clinical partners and develop a plan to address the needs of the community and to engage and recruit more members to participate in the available health resources. The intervention will be implemented by increasing community engagement activities in areas and populations that have been identified through the research conducted. Increasing the community participation in health resources will be implemented by continuing community education of resources, receiving more feedback, identifying members that have an interest, and continuing to promote participation by addressing barriers. The interventions should be implemented immediately and continually throughout the rest of the year and beyond. Most of the interventions are targeted at increasing participation of exercise activities during the winter months, which usually start in October in Northeast Ohio. Evaluation of community project. The success of the interventions in my community nursing project should be evaluated following the winter months of 2019. The evaluation will include analyzing data that shows either an increase or decrease in membership and participation through the winter months. Another evaluation tool that could be used is the expansion of the survey to include a more in-depth look at what resources residents want in the community. Following the survey I completed, most people, when asked what resources they would like to see in the community, they already existed and most of them were at the YMCA. The evaluation pathway. The first step in the evaluation pathway is setting outcomes and indicators. Next, collecting evidence. Next, analyzing and reporting, and finally, acting on your learning. Conclusion of community project. The community nursing project I developed and implemented throughout this course has helped me grow as a nurse. By assessing a need in the community and planning an intervention, I feel that I have made a positive impact on my community. The interventions that I started, I plan on to continue past the end of this course. As a resident of the community and as a nurse, I feel that by engaging with the community and increasing participation in healthy activities, I can help to improve the health of the community and to personally gain a stronger sense of pride in my community. The Community Health Project consisted of multiple community partnerships, different tools for evaluation and engagements, multiple types of assessments, documentation and reporting of findings to the appropriate community partners, and an overall opportunity for me to make a positive impact on the community of North Royalton.